Hello, and welcome to episode 21 of the God Cells podcast. I am Eric Merola. It has been a year since I've done a podcast, and this is the first podcast since I released my latest documentary last April. My first documentary on fetal stem cell technology was called The God Cells, hence the name of this podcast. But anyone can now watch my latest documentary, Ukraine Fetal Stem Cell Pioneers, free on YouTube. If listening on YouTube or SoundCloud, link in the description below. In today's podcast, I speak with Josh, who was diagnosed with intracranial hypertension, an extremely rare condition. When Josh started dealing with his illness, he spent almost all of 2023 in bed. He had to leave his job and qualified for disability. After going to at least a dozen doctors trying to figure out what was wrong with him and find a remedy for his problem, he finally watched my documentary, Ukraine Fetal Stem Cell Pioneers. He decided to go to MCell in Kyiv, Ukraine, and give fetal stem cell therapy a try. And after this therapy, he is now back to work. Oh, in the middle of all this, his wife just left him. I met Josh because he did see my movie, and he, like many, reached out to me via email, which I encourage you to do if you want to reach out. I have been to MCell around 4 dozen times since 2016, and 3 times during the war. I've had this therapy myself 8 times. It is not a bother for me to spend a little of my time responding to your emailed questions about this technology, because I know better than anyone how foreign this technology can seem, which is usually the case with any sort of innovative technology like this. That, combined with the seemingly impossible task of going to Ukraine during a war. I sympathize with all of it, and I realize that it is likely due to my journalistic work covering this technology that you might even consider going to begin with. I am here to say, as Josh will attest, it is quite obtainable. Traveling from Poland to Kyiv, Ukraine, and back is not the war zone. Ukraine is huge, the size of Texas, with 42 million people living there. The actual battlefield is in the far southeast. In today's podcast, we cover Josh's story primarily in the first hour, and then we have what I think is one of the most intelligent conversations I've personally had with anyone about the current state of the world, as we are living through 1930s Europe all over again, with a potential all-out war across Europe that could easily spill into the United States, very much on the horizon if Russia isn't stopped. So with that, I hope you enjoy today's podcast with Josh.
Hey Eric, how are you?
Good, how are you?
I'm okay, thanks for the call.
Yes, of course. Thanks for agreeing to do this. We've had endless hours of email and text communication, it seems, and it's great to finally talk to you.
Likewise.
Yeah. And one of the things I liked about you the most, Joshua, is that some of the questions you gave me before you went for therapy, I believe, were some of the most intelligent questions. Probably more so than a lot of people that have seen my movie. So I just was instantly, seriously, yeah.
Well, I would hope so. Obviously you're going not only halfway around the world, but you're going into a literal war zone. I mean, I would hope that anyone would have done their research in terms of, okay, what is this? What am I getting into? And what am I getting out of it? So those questions were really centered around just the voluminous amount of reading I had done up to that point.
Sure.
I appreciate that. I appreciate you certainly have my highest personal commendation for just answering in an expeditious manner all of my questions. I mean, there was never a feeling of, oh my gosh, am I bothering this guy? I mean, you really engaged in the conversation for someone who really needed some help, needed some feedback in terms of, okay, what is this actually, you know?
Yeah, well, that's why I plastered my email all over the place. I didn't always do that in the beginning, but once first of all, like the easiest reason I plaster my email all over the place is even before the war, because it is a long journey, I found myself fixing a lot of people's mistakes and their way they went about like booking things and everything. And I was like, all right, let me just, hopefully people will contact me first and I can just lay it out for them, because it's not a difficult thing to lay out for them because I've done it so many times. And anyway, yeah. And so of course, and because it's such a convoluted subject, and of course the second movie, I feel like I did a really good job of making it really comprehensive and learning so much of what I learned from after doing the first one. But I understand it's such foreign information, and if you're watching it only once, you're probably busy thinking about what you just heard while you just missed a bunch of new stuff you should have been listening to. You know what I mean? You know what I mean?
Yes, I mean our attention span, I guess, isn't large enough to really kind of synthesize all of the important points. I mean, you hear something and then you kind of forget it, and then this new thing is talking about. Well, how does that relate to whatever? So it can be somewhat overwhelming. But I mean, for me, the basics of the therapy and going to MCell was that. The basic impetus for me, and the reason why I paid such attention, was basically just based on just the lack of answers and results I was getting here. So, right. I mean, that was the impetus for me in terms of listening, following, reading, contacting others. Yeah, I mean, that's really what it's centered around, was just the lack of result. I mean, look, if it was such a shindig party going on here in America in terms of getting good health care, I would never have considered who Eric Merola even was or what MCell actually was. I mean, I wouldn't have. But, it was because there was a disconnect. And so, for me personally, I mean, I paid attention to every little tidbit, because it's like, okay, I need help.
Sure. Speaking of which, Joshua, forgive me for asking this question, because I do speak to a fair amount of people. Is that I'm going to also put a title on this podcast. Usually it relates to like the reason why you went. How would you describe to people listening, like why you went? If you don't mind, just like kind of doing a little bit of a deep dive and tell me like what was going on, what kind of therapies were offered to you, what didn't work. I don't know. Just, you know what I mean? Like, just kind of give me this.
Yeah. Just the chronology of all that.
Yeah.
So in the summer of 2022, and let's put it into context, this was roughly 2 years into the pandemic. Mm-hmm. And so, I mean, I had been a homebody for much of that time up to that point. And so I was married at the time, we had just been inside of the house for just a significantly larger proportion of time relative to pre-pandemic. Let me put it that way.
All right.
And so I had gotten out. We've got a beautiful island here in Detroit, Belle Isle. They've got a golfing, driving range. I just happened to be cruising by. I'm seeing people, hitting the golf ball. I'm like, oh, that looks pretty fun. That might be a decent outdoor activity. It was spaced out. It wasn't, indoors and all like this. So I just figured, and I told my wife at the time, it's like, hey, I just want to go try it. I just want to get out there and do it. So, knowing me personally, when I get myself into something, I just go full on, head on, and in other words, I'm like the next Tiger Woods, basically.
Right. Oh yeah. I know exactly how that feels. Yeah, go ahead.
Yeah, exactly. So I'm to condense all this. I'm basically golfing probably an average of 4 out of the 7 calendar days in a week. And I'm out there for probably at least 2 hours doing this. Obviously, I mean, I work as a statistician. I work in data analysis. Mm-hmm. And so I sit at a computer and come to find out in the midst of my journey, I found out that what I'm considered is called a weekend warrior, whereby you work at a desk and then all of a sudden on the weekend you get out and, you're Superman or whatever. So I had no idea about that term, but apparently I'm a weekend warrior. So I'm out there. Basically, the whole point of saying that is I'm out there and I'm physically ill-equipped to be out there doing what it is that I'm doing, and I'm unaware of this. I mean, I played football in high school. I ran track. When I was in college, I did, I don't know how many kind of intramural sports and all like this. I mean, I never, my brother, him and I would do boxing, in the ring. I mean, I've been in sports and whatnot, and it's like, what is golf? I mean, golf seems pretty innocuous. Let me put it that way. So, I've had a slight concussion before. I mean, I've had my body beaten up and abused. In no way, shape, or form am I thinking that golf can do anything along those lines to my body. You can have death by a thousand cuts, basically. That's really what I learned from all this. So what happened, Eric, is that one night I went to bed. This was, I don't know, who knows, maybe it was week 10 of this 12-week misadventure, let me put it that way, into golf. I go to bed and I start noticing some twitching in my left arm, my kind of golf arm, and I've completely overworked it. I know that I have. I mean, when I would get out there, I would feel spasms in my back, but, kind of going back to high school football, it's, you play through the pain, so to speak. And we have an understanding today, especially with concussions in football, that that's kind of the wrong way to approach sports. But, in my mind, it's like, oh, it's big nothing. So I started noticing what essentially turns out to be what are muscle spasms that I'm experiencing at night when my body is trying to relax. So, it's like, it's not a big deal. I mean, I had never really experienced muscle spasms up to that point, so I really didn't necessarily know what they were, where they came from, what the consequence was. It's like, okay, it'll go away, basically. It'll blow over. So time goes on, and one night I'm just kind of sitting here at the desk that I'm speaking to you right now, and I'm having dinner. I'm having a burrito and a beer, Chipotle burrito and a beer, and then I go to lay down that night, and then all of a sudden I just hear this just crack in my neck. It's in my neck, and mind you, I had just gotten back from doing some pretty intense golfing that day. I mean, just really intense golfing that day. And so I just hear this enormous crack just in my neck, and then I feel just this rush of pain down my left arm, this rush of pain up the back of my scalp. And my kind of body kind of just convulses. And I'm like, okay, this isn't normal. Something has happened. I don't know what's happened, but something's happened. So I go on, and I'm just in this immeasurable, it can't be measured, the type of pain I was in, Eric. I mean, this was pain from another world almost.
Okay.
And so basically time goes on, about, I don't know, maybe 2 days later. So this is August 15th-ish. About August 15th, 2022. A couple days later, I'm in such pain. My left arm is just spasming, just out of control. And it's only one side of my body. And I go to the emergency room. They check me out. I let them know my symptoms. I let them know, kind of what it is I'm telling you. They do some tests on me. They find that I've got an elevated creatinine kinase, which it's a measurement. It's an inflammatory marker measurement, basically, and it's very, very high. And so, I hadn't been working out for some days up to that point. But the ER doctor, he asked me, he's like, do you work out? I let him know, somewhat, whatever. So he kind of, I guess, particularly in the ER setting, I guess he kind of just dismisses this elevated creatine kinase as being attributable to that. That's what he dismisses it as.
Okay.
But then time is going on, and at this point, my mother-in-law is sick. She has apparently breast cancer. My wife at the time is out in California, Highland, California, where her family lives. And I just kind of tell my wife, I just let her know, it's like, hey, something has happened to me. I don't know what's happened, but like my body kind of spasms at night. I don't know what's going on. The doctor tells me there's nothing wrong with you or whatever. They've done a series of kind of cursory tests, quick testing on me. And, things seem to be fine. I've got some elevated markers on and on. So she just lets me know, basically, mom's dying, basically. You need to get out here. And I let her know, in the back of my mind, I'm like, I really shouldn't be traveling, because at this point, Eric, what I'm experiencing is how best can I summarize this? At this point, I'm experiencing what audience members listening to this and what the medical community would call basically symptoms of occipital neuralgia, whereby there's just this rushing pain up the left side of my head, and it's rushing over the left side of my face. It's just, I don't know how else to describe it.
And this was like a 24/7 scenario at times.
It was 24/7 dull pain, but this episodic, like rushing pain was episodic. That thank God was not 24/7. I mean, it would have really. It's akin to trigeminal neuralgia, if you've heard of that.
Yeah, I haven't.
Whereby,
go ahead.
I'm sorry.
I was just saying I have not heard of it. Go ahead. Keep going then. Yeah.
I mean, it's akin to that, whereby basically there is such incredible pain across the side of your face that there are many stories of people who have just committed suicide because it is simply that painful. It's the nerve, your trigeminal nerve controls something like, I forget the percentage, but I think the majority of sensation in your face. And just imagine that nerve is essentially being poked, prodded, and irritated in these episodes, basically. And so I'm dealing with that, and I'm just telling my wife, it's like, I don't think I should be traveling. I don't think I should be coming, because especially if one of those episodes happen on the plane,
yeah.
Oh my God, you would have heard about it on CNN, because I would have freaked out. I mean, they would have had to land the plane because it's like, I am in this little tube, whatever, 50 million miles up in the air, and I'm having just an episode, and nobody is here to help me. Nobody understands what's going on. So I've gone at this point to see a couple doctors, in retrospect, charlatan, like spinal people, whatever it is you want to call them.
Mm-hmm.
And they basically send me to, my case is just so unusual and severe that, well, let me back up. So they do an MRI of my neck, and they find that I have a bulging disc in my C6-7.
Okay.
So I have a bulging disc. So, they start selling me all these, oh, yeah, we can get it to roll back into place and yada, yada, yada. But, I got to get on this plane. I don't have 3 months to sit on this stretching bed and do that. I've got to get out to California. My mother-in-law's dying. My wife is kind of, on my back to get out there and be a husband, basically.
Right.
So he sends me to basically a pain medicine doctor who he gives me a shot that day. This is October 6th, 22. He gives me a shot that day, and it calms it down enough such that I get on the plane and I am able to actually ride the plane to get out to California. Unfortunately, I arrived just a few hours after my mother-in-law passes, so I just simply could not make it in time enough. But I tried. I mean, I really tried, and I would have been there. But hey, I'm dealing with my own kind of health complication. So, I'm in California. I'm assisting my wife, helping to bury my mother-in-law. But then, it's like, hey, this problem isn't solved. I'm still living with these spasms at night, this unbelievable pain, these spasms in the back of my head during the day. What is this? So I go to a chiropractor. He cracks my neck, I don't know how many different ways, my back, I don't know how many different ways. Just to kind of condense things, it comes down to December 5th. And I just tell my wife, it's like, okay, funeral's over with. I've got to go back. I've got to get back to the health system that I at least know of in order to deal with this problem. So I get on the plane. As I'm riding on the plane, Eric, this noise in my left ear just starts just out of nowhere as I'm riding on the plane.
Hold on a second. Got a noise in your left ear, like a tinnitus type noise? What do you mean?
Yes.
Okay.
So, right. So it basically this is the start of tinnitus. It's December 5th, 2022. So I know these exact dates because these are just seminal in my head.
Okay.
So tinnitus starts December 5th. I'm riding on the plane. So in other words, Eric, at this point, so this is December 5th, 2022. What's happened is my worst fear is that I said that I couldn't go out to California to be at the funeral and all like this. And what's happened is whatever this mystery affliction has now worsened into 24/7 tinnitus to add on top of all of the other misery that I'm going through.
Okay.
So, I have, basically doctors tell me, well, you just got to live with this. They still can't figure out all of these other problems. So basically what happens, Eric, is I find a doctor out in Newport Beach, Dr. Mork, because they've now, back in Detroit, they've now done all of this, imaging on my neck. They let me know, oh, you just have a bulging disc. It's not a big deal. Okay, and I've gone to I don't know how many doctors at this point.
Sure. Can I stop you real quick? Because I have audio damage in my right ear and tinnitus. And of course, the first thing they want to do is do an MRI to make sure there wasn't there's a specific type of tumor. I'm assuming they they did that, right?
So they've done, they did, I think it's called an MRV to check for basically pulsatile tinnitus. So I don't have these things. These things aren't basically causing the tinnitus.
Okay.
So they've kind of ruled out certain things at this point, and it's kind of a, we don't know what's going on with you type thing. Mm-hmm. And okay, this bulging disc, whatever, that's a problem, but people live with it. So I'm thinking to myself, there's in the course of reading all this, so my aim at this point is to at least get rid of the tinnitus.
Right.
I talk with a few audiologists, ENT specialists. They say as long as you don't have hearing loss, then your tinnitus can be arrested. It can be cured, because something like only less than 10% of people with tinnitus have perfect hearing, and apparently it's a matter of finding the cause, but then you've got to find the person who has the patience to go through that kind of exhaustive list of, okay, these 200 known plus causes, which one is causing yours? People are willing to do. You as the patient have to basically at that point be your own advocate, which is essentially what it is I am.
Right.
So I find a doctor in Newport Beach, the place where I just left, who over a series of months, he does some imaging on me. I find a paper on him, actually. He describes exactly what it is I'm going through in terms of just kind of pain and all like this. I'm going through Dr. Mork. And basically, he basically does a diagnostic invasive imaging, which shows that I have an annular tear at my C6-7. So the bulging disc is basically an annular tear. And for those who don't know what an annular tear is basically a pre-herniated disc. So it's a disc that's not herniated, but you've basically caught it before it's about to herniate. So it can cause just nagging, tremendous pain. It can. It just can. Maybe it's the cause of your tinnitus, maybe not, but it's definitely the cause of nerve pain, particularly in your left, wherever it's leaking out the most.
Mm-hmm.
I've reached a point of frustration with doctors here in terms of not giving me an answer to what is actually going on with me. So I find out about mesenchymal stem cells. And so there is a stem cell doctor in Grand Cayman Islands called DVC Stem. And basically, I go there. I pay $25,000 for him to shoot these cells into me because at this point, this is a true mystery affliction. And basically going back to kind of school, I mean, you're taught if you can't solve a problem, you kind of have to just hardwire things whereby you literally just do a trial and error. You start throwing stuff up against the wall, seeing what sticks. Mm-hmm. So I'm basically going through that process at this point. So I'm in Cayman Islands. This is June, July period of 20. Yeah, this is actually, yes. This is June 28th. This would have been on my anniversary. I actually got stem cells.
Okay.
So that date is memorable.
Of what year? That's 2022 or 3?
That's 22.
Okay.
Yep.
Right.
No, that's 23. Forgive me.
Okay.
Nope, that's 23. Nothing happens. Nothing works.
Right.
And that's how I came across your film about fetal stem cells.
Sorry to interrupt you. I'd love to hear just a personal curiosity, because I know it's hard to find my work. It's almost like some of it's like shadow banned. It's weird, but I'm just curious how you stumbled upon it. If you remember that process of how you discovered it, if you don't mind.
Had to be just YouTube searching stem cells.
Okay. Yeah. Okay.
Just YouTube searching stem cells, and then there was something about. Or the imaging for your film on YouTube, whereby it's like, all right, let me put this on. What is this? Yeah, so I find that, and I watch whatever it is, this 29-minute whatever film, and so I'm intrigued by it. It's like, I watch that, I'm amazed by what it is that I see, and remember at this point, Eric, no doctor, even my primary care doctor, he's like, sometimes you just don't find out what's wrong with you.
Right.
You just don't. So I'm like, okay, let me do more investigating of stem cells in Ukraine. And I'm just thinking in my head, Eric, I mean, for a novice, it's like, okay, if these things are doing miraculous things for these kind of last hope patients, it's like, okay, whatever it is that I'm going through it's got to help that at some level. That's my thinking at this point. It's like, I can't have just so much of a mystery affliction whereby, I can't be helped. Now, this should be prefaced with, I'm dealing with, it kind of settles in on me that I'm dealing with some type of neurological. I don't know how I settled in on that, but it settled in on me that I'm dealing with that. Now, my sister is someone who has hydrocephalus. She has epilepsy, etc. And all of a sudden, when she was in elementary school, she collapsed, and she's just lived with these problems her entire life. And so I'm thinking, Eric, is that happening to me? Is this what happened to my sister? Is it genetic? Have I acquired that? Has it somehow become symptomatic in adulthood? I'm thinking that. It's like, because nobody is able to tell me what in the world is going on with me, but I know something is going on with me. And I know, just kind of putting two and two together, that I have a sister that deals with unfortunately, neurological problems. I just figure, okay, I'm watching these things about MCL, let me go. Because at that point, I had gotten an MRI of my brain. It showed some what's called white matter damage. So there's some white matter damage. It was a part of kind of just aging, but it shouldn't necessarily be in someone who's 35. But it doesn't explain what's going on with me. That's
Sure.
I would more so have just kind of memory loss and stuff like this. And I don't have any memory loss. I mean, I work in a very technical job and I'm very proficient at it. So it doesn't add up. So I take a chance. I go to Ukraine.
Before you do that, so this was during the war, obviously.
Yes.
Can you mind kind of walk me through sort of like, because you've already been, but try to kind of go back in time, if you don't mind, because I think people listening to this would appreciate it. It's like, okay, I found this place that might help me. It's in Ukraine. Russia's trying to destroy it. You can't fly in. Like, if you don't mind, just kind of go through the, the basic. And of course, what your friends or family thought about you doing this. I don't mean to laugh. It's not funny, but yeah.
Right. So I have personally made the decision after I watched. It was your second film, I think it was, Ukraine, Fetal Stem Cell Pioneers.
Yeah.
After the second film, I said, okay, I'm going to do this. I mean, I'm sitting here in my living room watching it, and I'm saying it to myself. It's like, okay, I'm going to do this. So I'm thinking of, okay, how am I going to tell my family? At this point, they know that something is wrong with Josh. We don't know what it is. And he's already been to Cayman Islands, no results. He's been to, I don't know how many doctors, no results.
How many doctors do you think you went to, like guesstimation total?
Total up to this point, the number 13 is coming into my head.
All right, that's fair enough. All right, please keep going.
At least. So, So I invite my mother over to her and I watch the film. I told my mom, I said, whatever's going on with me, I'm going to go do this, And she doesn't give me any objection. She's encouraged by, the stories that she sees and all like this.
Mm-hmm.
So the day before I leave, this is, I believe I went the last week of September of last year. So the day before I leave, I showed it to my whole family and did a big reveal. Hey, I'm going to this clinic tomorrow. I'm getting on the plane.
Okay.
And, the reason why I did that is because I knew there would be all these objections. So basically my family made me download whatever this thing is, the iPhone tracker thing, so that they can always see where I'm at any point in time.
Right.
So it's like, okay, Josh, just agree to that, because this is a big deal. This is a big deal. So, so that is how I finally got on the plane and went to Ukraine, is that I told my family piecemeal what it is that I was doing. And the only kind of whatever arrangement that had to be made was, okay, I got to download the track app on my iPhone so that they knew where it is that I was.
Sure.
And then that was it. So I got on the plane. I flew to Paris. And from Paris, I flew to Warsaw. I stayed in a hotel overnight. The next morning, I got up. I met Diana, Zinzella, Adonis.
Oh, that's right. I forgot. You went. That's so cool. You got to meet them because they were in the movie, and they were back going there for their children. Oh,
Exactly.
Yeah, that's awesome. So you shared the van together.
Yep, we shared the van together, and then we all took a 10-hour road trip through Poland into Kyiv. And so I was there for 3 days. I explained to the doctors there at MSIL what was going on with me. They administered over a 3-day treatment, these stem cells. Everything was simple. They were very hospitable. I stayed at Favor Park, I believe, Hotel.
Yeah, that's where I stayed in the end of Fetal Stem Cell Pioneers. Here's a question, if you don't mind. It would be difficult because they don't have extensive diagnostics beyond blood, urine, ultrasound, and things like that. Was there any sort of further diagnostics? Did their doctors say, this is what we think is wrong with you? Did they put a label on it?
No,
Okay.
they didn't. I mean, in correspondence with them, they basically let me know that based on the symptoms I was telling them I had a nervous system problem. I mean, I was also, let me back up. I was also diagnosed with small fiber neuropathy, so that was a confirmed diagnosis that I was dealing with.
Okay.
And then the other problems I was dealing with was basically wrapped up into you have a nervous system issue.
Okay.
Not that the IMSO doctors necessarily, I don't think, knew. Now that, this whole story has something of a pleasant ending, but at the time, I don't think the IMSO doctors knew this diagnosis, that
Sure.
what was actually going on with me. The only thing that they knew, they could tell me, was that my symptoms ran parallel with someone who was having nervous system problems. That's about as much diagnostically as they could tell me. And then I was there 3 days, I think an average of maybe an hour and a half to 2 hours every day.
It had to have been longer than that. I mean, it's usually like 4 to 5. Really? You were in and out of there an hour and a half every day?
Okay, maybe I'm off. Well, I'm thinking. Let me factor in the massage as well. Okay, maybe an average of 3 hours.
Okay, yeah. The cells.
I'm thinking about the actual stem cell. Transfer.
Yeah. It's pretty fast. Yeah, absolutely.
Yeah, it's pretty fast. And so I'm there for the stem cell transfer, the massage, the breakfast. You sit in the salt room.
Mm-hmm.
I'm having something of a fun conversation with my translator, who was a total sweetheart the entire time.
What was the person's name? Do you remember, the translator?
I don't know. It doesn't matter. Cute, though.
Okay.
I remember that.
Yeah. Okay. So it was one of the female translators. Okay. Yeah.
Well, one of the female one of the female translators. And so, right. So yeah. I mean, what's interesting is that as they they have a basically a chauffeur come and pick you up from your hotel, and as you're driving through the city, you're seeing that come to find out that Ukraine economically is the poorest country in Europe, and you can kind of see that, at least when driving through the city. And then you drive into the IMSO kind of compound, and it's so technologically vibrant. I just felt hope driving into this compound.
Yeah.
Let me just put it like that.
It's something out of Silicon Valley. It's incredible, isn't it?
Yeah, exactly. I mean, and I worked up in the Bay, so it gave you kind of that feeling of, okay, these people, whatever they're doing here, it's good. Whatever they're doing, I don't necessarily understand 100%, but it's going to do something good. Something good. So that was my thinking when driving up on this. And by the way, the restaurant that you recommended to date, and I thought that I'd tasted because here in Detroit, lamb chops are a big deal. To this day, Eric, I have not tasted better lamb chops than that restaurant that you sent me to.
Yeah.
And I have a picture of the lamb chops, and I let people know, like, our food here. I mean, this is a country literally in the middle of a war. I got better food there than here.
Oh yeah, no, and my wife's a private chef. We're both big foodies, and no, we just can't wait to eat the food there. And because that restaurant is a Georgian restaurant from the country of Georgia, and not all of the Georgian restaurants in Kyiv are as good as this one. I mean, but there's some of the best food I've ever had is Georgian food. That's hands down. I mean, it's unbelievable, especially if you enjoy things like lamb chops or So
yeah. I mean, it was. I just couldn't believe it. It's like they are in the middle of a war and they're able to have just a better option of food here. I don't know how accessible this type of food is to the average Ukrainian, but it's just what I had there totally bested out basically the best restaurant I've had here in USA. I mean. And I've been to New York, San Francisco, et cetera. I mean, I've eaten in some of the better cities and whatnot, and it's just, it goes to show you my IMSIL experience was great. So I wrap up in Ukraine, I get back home, I'm still dealing with this noise, pain in the back of my head, but I go to get myself blood work measured, and so the inflammatory markers were finally normalized. Mm-hmm. So I knew that was directly attributable to the stem cells because I had been tracking these variables ever since the saga started.
Mm-hmm.
So they were always elevated. They were always out of whack. And it was the indication that they're absolutely, because basically, as I've read more about human affliction and diseases and whatnot, the genesis of it for almost all of them starts with inflammation.
Yeah.
So my inflammatory markers had normalized, and they remain normal to this day. I continue to measure them, and I know that it is directly because of stem cell therapy in Ukraine. I mean, they were not normalized after mesenchymal stem cells in Cayman Islands. They just weren't.
Yeah. Well, and the reason for that is that some people pronounce it your way, some people not. I usually pronounce it mesenchymal, but it doesn't matter. Is because they're not organ specific cells. That's why they're not going to do anything for your organs. They're not really doing anything much for anything inflammatory that is organ related. And of course, with fetal, you're getting nearly 24 organ specific cells. This is as a sidebar, like people that watch my movie and they go, hey, I saw your movie. It's really great. I can't go to Ukraine because, Russia is trying to invade them, but I think I'm going to go to Mexico and get mesenchymal cells and I have Parkinson's or MS. And I'm like, dude, no, it's not going to do anything for you. I know it's a bummer. You have to make this journey to Ukraine, but if you really are looking to solve this, you didn't grasp what the movie told you.
Right. You did not grasp that. I mean, this is the only place in the world. And I love in the second film how you go through and you show like the clinical trials and how they're offering like mesenchymal stem cells and whatnot for the neurological ailments. And it's like, whatever findings come out of that should be taken with a tremendous grain of salt, because it's like, we have an understanding that it's not going to, I think as they explained in the video, there's no mechanism that exists for them to convert into a dopamine neuron or into a GABAergic neuron or to affect the movement areas of the brain. The mechanism doesn't exist. So you have to, the big message that I want to give to people is, if you're trying anything other than fetal stem cells, and let's just be honest, anything other than fetal stem cells from Ukraine, I mean, you've got to really be scrutinizing and skeptical of whatever the results are, because, I mean, I took the dive. I went to Cayman Islands. I'll think of the clinic name. It's okay. The clinic name there in Cayman Islands.
They're frankly, honestly, no offense to the clinics, but they're all the same. Doesn't matter.
I mean, but it's true. It's like, this didn't work at all. It was 25 grand. And so it's like, whatever they're talking about in terms of results, DVC stem, that's what it is. DVC stem. If they've got, they're all the same. They're not producing the results that they purport. I mean, and so if you're not getting stem cells from M-cell, let me just put it that way, then you've got to take the results with a big grain. And to be honest, here's the thing, and I've made a couple of doctor friends along the way here. The reality is that the stem cells that are actually effective, Eric, they were cheaper at M-cell than these other yahoos who are offering stem cells that don't work, or if they produce anything, it's minimal at best. I mean, it was more affordable to go get some real powerful stem cells in Ukraine as opposed to whatever else is being offered on the global market.
Yeah. And like I'm not trying to call it out. Well, I'm going to call it out, I guess. But there's a big clinic in Panama that became really famous because Mel Gibson and his father and Tony Robbins, and they all went there and had good results. Why? Because they had shoulder sports injuries. Sure, if it's a basic joint issue, that they're going to help, but it's not going to help anyway. But they're charging like $30,000 on up. It's just But
right. So it's funny you bring that up. That's a part of it. I watched Mel Gibson talk about his dad and his hip injury. And I'm guessing, from what it is I've read, mesenchymal stem cells maybe are effective against maybe kind of basic, whatever, joint sports injuries, things of that nature. that's fine. But I was dealing with some heavy duty stuff that it's like, whatever this is, it's not going to convert into what it is I needed to convert into.
Yeah. Because
so that's, yes. But that was on, in fact, I watched Mel Gibson, obviously, prior to watching Eric Merola, because it was Mel Gibson.
Sure. That's usually always the case, honestly. Yeah.
Yeah, that's why they have Mel Gibson's face on there, because it's like this is William Wallace, it's Braveheart. I mean, you trust him, right? So he was definitely a part of the journey, and it's like I look, for his dad, I'm sure there was whatever, but it wasn't for me.
Well, as I said, sorry, go ahead.
No, go ahead.
I was just going to say, as I pointed out in the movie as well, and it's okay if you don't remember, but I did lay it out, and I say mesenchymal, based on the data and based on the, everything that we know, they can help with connective tissue issues. Like, that's why you hear about basketball players and football players that are heavily injured get back on the football field faster after stem cells. But it's not going to help with a neurological problem or some kind of immune-based problem. But anyway, so they parlay it and parade around these people, and then they also advertise it for autism and Parkinson's and anyway. But before you continue, Joshua, if it's okay, because I know people listening are dying to hear. Because if you don't mind talking about the results you had, because we've been going on for a while and we haven't even talked about that.
Yeah.
Okay.
Yeah, I mean, so the results from INSO.
Yeah, I'm just would love to hear the timeline because as you know, and as they told you, it takes time for the cells to proliferate in the system after injection. You're not going to, rarely do you have this overnight, result. It takes time for the biology to do its job, And I would just sort of love to hear sort of.
Yeah. So I measure my blood pressure, whatever, in the midst of the saga, I measure it. That definitely dropped. I definitely saw some decrease in kind of the spasticity that I was dealing with.
Mm-hmm.
I mean, I can say, I can honestly say that, it's and my inflammatory markers were finally normalized. That was a big deal because as that inflammation goes on, that can turn into something even worse.
Sure. Yeah.
So my creatine kinase and lactate dehydrogenase were fine. It was repaired where, I don't even know where it was in my body, but it was repaired. Mm-hmm. And so I knew that was a problem going to IMCEL and that needed to be repaired. So in terms of an objective measurement, because me working, I'm an active scientist, so
sure.
Those were very important to me. It's like, what can I actually measure beyond just, I think I was able to actually measure, okay, your inflammatory markers are now normalized. And I knew as a causal factor that was IMCEL. I knew that because I had kept track of these for whatever amount of time up to that point, over a year of keeping track of this. So they were absolutely effective. And I think we mentioned it, they were absolutely effective in repairing that kind of inflammatory damage wherever it was in my body. It could have been brain, it could have been, because those things leak out into the blood system. It could come from the brain, the heart, the muscle. It could come from anywhere. Mm-hmm. So in other words, there's an organ somewhere in your body that's damaged and it needs to be repaired. IMCEL did that. Yeah. It did that. But I was still, at that point, I'm still, even right now, I'm still living with certain symptoms. And basically it comes down to, Eric, February 28th, I finally had a lumbar puncture, which I'm guessing many people who listen to this would know what that is. Basically, they stick a needle into your back, they draw out your cerebral spinal fluid, and they basically check. It's for assessing a range of neurological issues. Mm-hmm. The findings of that finally came out February 28th of this year, so whatever, a week or two ago. So basically, the mystery affliction, drum roll, the mystery affliction that I've been dealing with, Eric, is intracranial hypertension. Now, I would have never, ever guessed that I was dealing with this whatsoever. One of the first things I did was to email MCell and ask them, have they dealt with this on and on? This affliction is so rare that this needs to be said. It needs to be said clearly. MCell deals with rare neurological problems. Mm-hmm. Okay, first statement. I have a neurological problem that is rare. Even the clinic that deals with rare issues, my affliction is so rare that even they let me know that they have not treated enough patients to even give me statistical patient outcomes. That is how rare this is.
Yeah.
And I hope that that's clear what it is I just said. That is how rare this is, what it is I'm dealing with. Intracranial hypertension is basically the brain, deep down in the brain, it makes this fluid. I never do this, Eric, but deep down in the brain, it makes this fluid for your nervous system or whatever, and it keeps your body going or whatever. That's the best way I can describe it. I'm still actually reading up on exactly what this is, but that's what I summon it. So what happens in intracranial hypertension is that fluid needs to drain out of your cranial vault, out of your head. It's got to drain somewhere. What is happening is that fluid is not being drained. So at this point now, Eric, I now have the official diagnosis of what it is I'm dealing with. I'm dealing with intracranial hypertension. It happens to 1 or 2 people out of 100,000. So let's just think about that. The probability of occurrence, incidence rate, the epidemiological report is that 1 to 2 out of 100,000. So that basically means in the USA, it's anywhere from 33 to about 6,700 people are dealing with this. If you multiply that out to the world, it's anywhere from 81,000 to 162,000 people. So that gives you kind of a hard count as to the rarity of this. And this is the primary reason why this wasn't being found. But the angering part about it, Eric, is that the lumbar puncture is basically a part of a routine neurological analysis that should have been done a long time ago, and it simply wasn't done. Mm-hmm. That's the angering part, is that the test to find this out is, yes, it is invasive. Yes, if you're not showing certain signs of things, they don't necessarily call for it. But come to find out, I was showing signs of it. What were the signs? I was having tremendous body pain, terrible headaches, and tinnitus. Mm-hmm. Those are all classic symptoms of intracranial hypertension. In fact, it's a part of the same pathophysiology of fibromyalgia, chronic pain syndrome, and on and on. And unfortunately, what I found out in the course of this, Eric, is that those patients with those afflictions are normally summarily stereotyped, typified, and mocked by the medical community. Mm-hmm. But they are, in fact, dealing with a true problem.
Sure.
And this is exactly what happened to me. In fact, in the course of this, I went to the University of Michigan to the emergency room one night. I know I'm kind of jumping, but this just goes to kind of demonstrate how you're just dismissed. I went to them with a medical problem to their emergency room. Basically, long story short, they diagnosed me with psychosis.
Wow. Oh my God. Wow. Okay.
And I had to fight to get that change, but there's the whole racial component history. For those out there who don't know, I'm an African-American male. I'm 36. Mm-hmm. There's a deep, long racial history of passing that psychosis diagnosis out that I read about. There's a wonderful, if anyone wants to read it, there's a wonderful New York Times article published April 30th, 2021 by Judith Warner. The name of the article is Psychiatry Confronts Its Racist Past and Tries to Make Amends. And it just goes through. And the reason why this article had such a grabbing attention to me is that it talks about how the diagnosis of psychosis going back to the 70s, it was passed out to Black men in such a fashion such that it kind of lost meaning, basically.
Wow.
That is how, so here we are, Eric. I'm at one of the world's premier research hospitals. I'm dealing with what I now know, I just found out a couple of weeks ago, is truly a rare affliction. Intracranial hypertension, actually, it's a part of the class of neurodegenerative disease because it degenerates brain tissue, what it is that I'm understanding. I'm at one of the world's premier research institutions, and instead of them doing a professional job on me, they would much rather just label me with this label of psychosis that the psychiatric field has had a racial problem with for known decades, if not centuries, whatnot.
Wow. Okay. Now, obviously, you read this article first, or was it after?
No, I didn't read this article first. I read it afterwards because I was just livid. It's like, I know that there's something medical happening to me, and then you give me this psychosis doc. So knowing the type of just kind of, researcher that I am, I'm going and looking for, first of all, I'm looking up exactly what is psychosis, and I'm like, okay, I'm not that. And then I unfurl all this literature on racism in psychiatry. So, it's like, okay, there's clearly, Eric, it is obvious that there is a racial component that went into the lack of care for me, for someone who is dealing with one of the world's truly rare neurological afflictions. I was simply labeled as crazy.
Wow. I'm kind of speechless. I don't even know how to respond to that. I mean, yeah.
I mean, yes. I mean, that is exactly how it's like. I just can't believe. In other words, I can't believe that this whole saga is happening to me. From all the doctors I've seen to having to go to Cayman Islands, having to go into a war zone, having to go beg a neurologist to give me this lumbar. It's like, what the hell is this?
Yeah.
Why can I not just get the same care that, come on, Eric, let's just be perfectly honest, that a Bill Gates, a Warren Buffett, a President Joe Biden would have gotten if they had gone in complaining about these symptoms? They would not have been dismissed as crazy.
Yeah.
And come to find out, what's frustrating about it, Eric, is that, and I went back and looked at the claims I had made on my insurance. I hadn't made a medical claim on my insurance, meaning I hadn't gone to the doctor. I think it's been like 3-4 years. Like, there was absolutely no history, and they called me a hypochondriac, University of Michigan. There was no history whatsoever of me being a hypochondriac, me being, I had gone to school. I had done well in college. I had gone to the University of Michigan, gotten a master's degree in statistics. I mean, it's like, if anything, I'm above average. It's like, why am I being labeled as crazy when I have no history of this? There's clearly something off, something wrong. And then come to find out, reading this article in the New York Times, this is 2021, so whatever. It had been a year prior to me going. There's apparently things in place the article speaks about where psychiatrists need to listen more to patients and on and on. I mean, clearly it's not being done because, come to find out, Eric, I mean, look, as this affliction has gone on and on, it's continued to hurt and literally damage my brain. And I'm there at one of the world's premier hospitals to get help for this affliction, and they just send me packing with a psychosis diagnosis.
Yeah, I know.
That is the only thing that caused me to find your video, to find Cayman Islands, is because of just the lack. That's just one kind of anecdote in this long, winding saga. But those are the types of things that happened to me that led me to your film, that led me to stem cells. And it finally, I mean, one of the doctors let me know, they let me know, Josh, without your diligence, we would have never found that you had intracranial hypertension. I'm just thinking to myself, it shouldn't have taken my diligence. All it took was your professionalism.
Yeah. One thing that in my years of before I did this, dealing with a lot of cancer patients and people with cancer, and I try to remind people, which I think you're not one of them, is like you are the boss. Like it's almost like you're a contractor and you're hiring the bricklayer. Like the bricklayer is the doctor. Like you tell them what you want. Like there's a level of expertise, of course, in being a doctor, but sitting blindly and expecting the doctor to answer all of your problem, it's just no. You have to take control, and you did that. So yeah.
Yeah. I mean, and I did. I took video of these kind of spasm activities that were happening to me at night. I'm showing them. I am bringing kind of data that I've measured. I mean, I'm being summarily dismissed as a crazy person in the midst of doing all this, but in reality, what I'm putting is my scientific training into action to help myself, and I'm trying to convey that to other scientists in terms of, okay, there's something going on. Why aren't you taking this seriously? Because in the midst of all this, Eric, it led me to a doctor who did migraine headache surgery, Dr. Guyron in Ohio, and he wound up severing my lesser occipital nerve, literally cutting it. And it didn't need to be done because someone did not take the time to do this lumbar puncture to find that I had this rare intracranial hypertension, which can manifest to look like cranial neuropathies, which is basically the symptoms of, it's a pretender. In fact, intracranial hypertension is called a pseudotumor. So you have kind of tumor symptoms, but you don't actually have a tumor. That's the evil kind of this. So the lack of professionalism led to some charlatan cutting my nerve and my scalp. It feels just as painful as it sounds. I mean, but the reason why I'm saying these things is that it gives you an idea of what happened to me because of a lack of care. That's the whole problem in a nutshell, whereby this could have been found out at the very beginning. At the very, very beginning, this could have been found out. Now, we kind of return back, we snag back around and get back into kind of the chronology of things in terms of finding out that I have intracranial hypertension. I took a visit to a Dr. Hauser in Florida. This was prior to the lumbar puncture of me finding out that I had intracranial hypertension. And Dr. Hauser, I'm sure some people listening to this probably know of him. He's a neck doctor. He's all over YouTube.
Okay.
YouTube did more for me for healthcare than the actual doctors themselves. So I find this guy on YouTube. I go down to Florida. He's in Fort Myers, Florida. And he does a very, very thorough assessment of kind of your neck. What he basically finds, Eric, is that my jugular veins there's something wrong with my jugular veins. The area surrounding it is narrowed. There's probably some degree of stenosis or whatnot. Now, why is this important? It's important because any form of obstruction, kind of chronic obstruction of your jugular veins, is a known cause of intracranial hypertension.
Okay. Wow. All right.
That's the reason why this is important. Now, I didn't even make this connection. I would not have known that if I hadn't gone to him. Now, even the neurologist who gave me the intracranial hypertension diagnosis, in all likelihood, I mean, they did this to me. They just tried to pass off a few pills. In fact, they call it idiopathic, which, for those who don't know, it basically means, well, we don't know what's causing it, so we're just going to give you these pills.
Right.
So I was able to present that to the doctor in terms of, I have apparently some type of jugular vein problem. From what I understand and have read, that's even rare amongst the people who have intracranial hypertension. So,
wow.
it's like I've been dealing with a series, being a probability guy, I've been dealing with a series of what are truly, truly, truly rare events. Just truly rare events. I mean, I've had to literally hopscotch around the world and around the country, piecing together what is effectively this is a medical mystery. But you're talking to me now at a time period where we've basically figured out the what, and we need to confirm the why.
Okay.
The what is intracranial hypertension? Why is it happening? Even the neurologist last week, they let me know you are a very, very unusual case. This basically only happens to very, 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 very obese, apparently white women in childbearing years. In fact, in the world, there's a very high incidence rate of this in Ireland. And, my mother, she did the whole genealogy test. The only kind of European we have is Scottish. So, okay. I'm still trying to figure out, well, how in the world this happened. But in all likelihood, it is, in fact, this even happened. I said this before I went to Ukraine. I said my problem can be bisected into two problems. I either have a structural problem or cellular problem. Come to find out, I in fact have a structural problem. Now, stem cells aren't going to move whatever the bones out of the way so that my jugular veins can finally breathe. Mm-hmm. Maybe they do or whatever, but from everything I've read, that's not gonna. You got to get some heavy duty whatever equipment, an actual surgical procedure. And for those out there, MCell always tells you to follow your doctor's recommendation, wherever you're at.
Sure.
Follow that recommendation. And so, just in communication back and forth with MCell, I'm keeping them updated on what's going on with me. But basically what this is, they have yet to confirm this jugular vein cause, but it in almost all likelihood, it is the cause, because what else would actually cause this to happen to a young, fairly healthy African-American male? Well, it's a structural problem. And what you need is a vascular neurosurgeon to basically stent the jugular veins to basically permanently open them so that you can finally get the drainage and whatnot to go. And so there is, from what I've now read, there is, in fact, an effective cure. Those who go through the procedure have very high patient outcomes. They get rid of their tinnitus, their headaches, just the problems that they're dealing with, because finally their veins are able to actually drain the fluid out of their brain. And
right.
that is what the problem is,
Okay, wow. So go ahead. Sorry.
So that's it,
So essentially, well, let me jump ahead for a minute. So how is your overall quality of understanding the structural problem? And aside from the measurable results, but I'm just curious, has your quality of life improved since returning from MCell overall, even knowing all of this?
Yes. So I have been able to, I took 6 months off from work. Mm-hmm. What was that, last year in January? I had just gotten a really, really great job, and I had to just take time off because, I just couldn't work with all these variables moving at once. So, yes, in January, I restarted work again. I am able to work. There is some attribution, I would say, to the stem cells from that perspective. Mm-hmm. Certainly, I've had a doctor friend of mine let me, in fact, he just texted me today before I got on the call. He's like, Josh, you're 70% better.
I'm sorry, he said, sorry. Can you repeat that? What?
A friend of mine, he's a neurosurgeon. He's a friend I've made along the way in all this. He let me know, Josh, your symptoms are 70% better, because when he first came into contact with me, this was before MCell. Mm-hmm.
What did he base your symptoms being 70% better on?
Just my interaction.
Oh, I see.
My interaction with him.
Okay.
Kind of a qualitative measurement.
Sure.
And it's true. I am to some degree better. Mm-hmm. And the way that I measure that is I'm at least able to start working. Mm-hmm. Post MCell.
So wait,
So
did you actually quit your job and not work for a while before going?
no, I
Okay.
didn't quit. I went on disability
Okay.
for
Got
6
it.
months.
Got it. Got it. All right. All right.
Yeah, no, I had a really fortunate manager who he was very understanding. He too had a friend who had been suffering with tinnitus for 15 years or whatever. So he said he understands, and I needed to go somewhere and try to figure this mess out. So, they allowed me to go on disability. They actually gave me approximately a year to be off, but I wasn't going to be off a year. I wanted to get back to work.
The
But
point is,
yeah, I mean, in the course of all that, that's the reason why I went to Cayman. That's the reason why I went to Ukraine, is because it's like, okay, I only have so much time to try to get better. I need to try everything, including going into a war zone.
sure. I guess the point is that this situation was to such a degree that you went on disability because you didn't feel like you could function at work, and now you can. That's the point. Okay,
Yes.
that's great.
Yeah.
That's awesome. Let me ask you a question. Now that MCell understands what your diagnosis is, again, I have no idea what I'm talking about here because I'm not a doctor in the sense that I would know. But I'm curious if did they recommend intrathecal spinal injections of the neurological cells now that they know what this is? If you ever go back.
We've talked about that. The only reason why they didn't do that initially is because I had a bulging disc
Right. Okay.
in my lower back, but that has now been cleared. I need to get an MRI. They're waiting on an MRI to just confirm that because they want to make sure that the whole procedure is safe. So I need to go get that MRI. But yes, that will be a part of it. And my whole plan and operation is that once the kind of structural problem is fixed, I'm absolutely going back to IMSO.
Sure.
Because finally, the kind of, as I said, so there's two things that are damaged. I would have solved the structural problem at that point, and whatever the cellular damage is left over, I have the absolute highest confidence that IMSIL will be able to assist with that, because I've seen it. I saw the measurements. I saw it. I saw the blood work whereby, okay, this is now normalized. This inflammatory marker is now normalized, and it was only because I went to Ukraine, and that's it.
Yeah.
So, it only makes sense that after the problem, the operation corrects the bone structure. It's like, okay, time to address whatever the cellular damage is, because that bone structure problem existed.
Right. As you figured out by now, it is, even though you went there for one specific issue, they're treating the entire body. They're not just focusing on that individual issue.
Yeah.
And so
exactly.
it's just going to help you in many ways overall anyway. So yeah. Wow.
Exactly.
Yeah.
Exactly.
What a story. It is. It's so interesting too. I mean, everyone is so different, but the vast majority of the people I've met and done these podcasts with are usually people that have a similar journey as you, where they're like tired of doctors saying, I've never heard psychosis, you're the first one, but tired of doctors saying, we don't know, maybe just got to live with it. And and then they finally get some relief from this therapy. Of course, yours is a little different. They did finally diagnose you, but wow.
Yeah. I mean, the final diagnosis came because I was just persistent with it. I said, okay, the cells did clear up something, but okay, I've kind of ruled out that the cause is cellular, so it must be structural. And come to find out, it was. Yeah. I mean, there's something in my neck that literally has to be moved, literally has to be operated on and moved out of the way. And IMCEL encourages you to do whatever the surgical procedures that your doctor insists that you do.
Yeah, because the truth is, this therapy is very powerful and it's regenerative in nature, but it's not going to replace a required surgery. Exactly.
That should be that should be said. I mean, if you need some surgery in order, and it's known to have a high patient outcome to correct your problem, then you need to do it.
Yeah, and if anything, I don't think you would necessarily need to do it in this case, but like people that would need a really, maybe you would, I don't know. But what I'm getting at is, once you're like basically recovered from the surgery and you went back shortly after, it's only going to speed up the remaining sort of healing process because of the regenerative nature of the cells. I mean, they're going to go crazy trying to heal that even faster. So,
right.
Yeah.
That's why, Eric, I let my family know. It's like, okay, when this is finally whatever operated on or fixed here, I mean, I'm going back to Ukraine. I just am. Because I've seen it. I've seen this. I call it the juice. Diana and Zinzella laughed at it, but I call it the juice.
Yeah.
I said, I'm going back for them to give me their top shelf juice.
Yeah, right. So you still stay in contact with them a little bit?
Oh, yeah. Zinzella and I, we actually just messaged last night.
Oh, that's great. That's awesome.
Yeah, I keep up with Zinzella and Adonis, and she let me know that I guess one of the I guess medical people working with Adonis let her know that there's just a night and day difference between him and I guess the other patients with his affliction. And it's like, okay, that's obviously stem cells, obviously.
Yeah, dude. I mean, we don't have to go on a tangent on this, but watching muscular dystrophy, it's so tragic. Like with Diana and Sophia, those parents, Diana and Matt, were so diligent, kind of like you. As soon as they got that diagnosis, they just looked at each other and said, "No way, we're going to let this happen." Like, I mean, even like defying Mother Nature, right? I mean, and so within months, I think within 6 months they got the first therapy, and when she was 4, I think, and she's now 16, driving her own car. And the point is that it's such a shame because so many parents have children with this affliction. And they see the movie, and they've talked to, even some of them have even met like Adonis and or Sophia at their doctor's office, and all the other kids are in wheelchairs, and this kid's walking around, and they're going to see a muscular dystrophy doctor, and they're like, "Wow, your kid's doing great," and they explain, and then they just don't do anything about it. It's really tragic. I know that some people probably couldn't afford it, which is, of course, that's obviously, but it is astonishing. So yeah.
Well, Eric, I had this conversation with them on the bus. What frustrates me because it's a political impediment as to why we don't have fetal stem cell therapy in America. Prior to the Supreme Court overturning Roe v. Wade, I mean, the hardest part of fetal stem cell therapy was legal, which is the whole abortion part. I mean, that's the hardest part. It was legal at the federal level. So that's the hardest part. It was legal. I mean, it's like, okay, now let's take the next step at the federal level whereby, we at least use this fetal material. Okay, yes, I get it. We have ended a life, whatever, I get the tragedy of all that. But as long as it's legal, let's at least take the next step in terms of, it can help people who have, unfortunate ailments and whatnot. And that's the really unfortunate part, is that the help exists for people out there in order to get relief. I mean, look, I told Sophia and Diana, I mean, you would never know that Sophia was afflicted until maybe you saw her gait or something like this, but she looks perfectly normal. Perfectly normal.
Yeah.
Perfectly normal. You would never know.
Cheerleading squad, driving her own car around. I mean, every other child her age is, if alive, is on a wheelchair and a feeding tube. Yeah, yeah. It's
unbelievable.
Let's since we're on this note, like you talked about abortion being one of the biggest impediments, and it's true. Like an example would be, because I've been making these movies for a long time now, but for obvious reasons, I became really focused on this. But like my point is that in the early days of making my movies about some other medical therapies, and one was a whistleblower related to a cancer therapy. But the point is that I had a big kind of support base of people that helped, like people that had a large audience on Twitter or whatever, and they would help kind of promote my work. And as soon as I started documenting fetal stem cells, they would not touch it. And they were like, Eric, great movie, great therapy. But we can't promote this because we'll just anger half of our audience. It's like, wow, it's like, there's such an obvious, yeah, seriously. And then secondly, I think this is important. And I think I've said this previously in other podcasts, but, cause I've done a deep dive on this, and this really isn't the best news to talk about, but yes, you're right. In a moral, just, sane world, we would overcome this the abortion issue and move on to try to make this available. But of course, if a person decides they want to terminate their pregnancy, I mean, that's going to happen every day. Like it's like 50 million a year, as I put it in the movie. I mean, there's like, by the time we are done with this phone call, I don't know how many dozens, if not more, have occurred just in this country. And it's not that people are getting pregnant on purpose or anything of the sort, as you know. But okay, so let's pretend for a minute like we got past it and Elon Musk or whoever said, all right, we're going to fund clinical trials for this, Here's the problem. Fetal stem cells doesn't fit in the market system. It can't be patented like, say, any other drug, like a Propecia or a Cialis or whatever you want to, all these different drugs that are on the market for cancer or whatever. That's the name of the game. You spend all these billions through clinical trial process on a chemical-based patented formula that nobody can copy without being sued into the oblivion, right? But this is just biology. So let's just pretend like Elon, and knowing that, let's just pretend like, say, an Elon Musk or whoever said, I don't care, we're going to spend the billions to get this done. And let's just say it took 50 years, of clinical trial. I'm going to get on that for a minute as well. But let's say they did it. They got it on the market. Every other biotech firm would just go, thank you so very much for spending 50 years and how many untold $1 trillion to get this on the market. Now we're just going to compete with you. So you have that. And then you add to that, oh my God, what is pharma, the chemical-based company, is going to do when no one cares about your diabetes medications and your anti-inflammatories and your painkillers and your Parkinson's drugs and your MS drugs and just you name it, or even open heart surgery for that matter, right? And so you're talking about something so destructive to the market. Okay, and then because I've done such a deep dive on this because I thought about putting this in the movie, but it's so complicated. It almost deserves its own movie, but it would be boring because no one would watch it. But the point is, too, is the way the clinical trial structure is designed, not just in the United States, but pretty much all like sort of first world countries, is you are only allowed to test usually a new chemical for one ailment. So MSL is giving nearly 24 different cell types at the same time, okay? So you have a Parkinson's patient, they're gonna go, okay, we can only do dopamine progenitor cells. That's gonna take another 9 years to get this done, right? Okay, and then, okay, now let's add these other neuronal cells. There's another 9 years added to that. And then let's add this, and let's add this. You're talking about, I know how absurd this sounds. It could take 1,000 years to get on the market. Forget about the market forces not wanting you to do it, but to get it on the market based on the regulatory system to get where MSL is today. It's just amazing. And it's just a mind blower.
Right. I'm aware of that, and even in the midst of what it is I'm going through, Eric, I tried to actually get into clinical trials for tinnitus, and it was a headache even getting into that, and it had to do with this nonsense psychiatric diagnosis or psychosis diagnosis. You all of a sudden get labeled to not even be within that. But yes, I totally got introduced to it's just a red tape labyrinthian model in terms of getting things approved for therapy. They go kind of one affliction at a time, and it's like, well, America might not even exist by the time you're done approving all of this,
right?
Precisely. So it's inefficient, basically. Totally inefficient.
And that's why and for me, where I sit, and I'm sure you agree, that's why it's so tragic about what is happening. Like, you have this tragedy of Chernobyl, which morphed into this incredible discovery to be kind of fast-tracked through because it was curing bone marrow failure from people that were it's like a $500,000 bone marrow transplant that has a high mortality rate to even get through it. And so, no, here's just a little batch of fetal liver cells. Oh, go back to your life. You're cured of bone marrow failure. Anyway, so it's obvious why the government fast-tracked it, and they may be able to hold on to that. And then, of course, you have Russia trying to just basically wipe out the whole country. Oh my God. It's just really, really intense, man. It's really intense.
It's interesting, Eric, is that I just had this conversation with a friend of mine. I've never really been a voter, actually. And, look oddly at me, but this presidential election coming up, I have a vested interest in the war in Europe now.
Yeah.
I have a true, I mean, I'm getting my family registered to vote. I mean, it is simply because we need our U.S. Congress and our president, our leaders to continue to support Ukraine in their fight against Russia. And, and Donald Trump is someone who has, I mean, he said in no uncertain terms that there is just no interest whatsoever really in really fighting the criminals of the world, which is who Vladimir Putin is. And so I've become galvanized because I have a medical interest in seeing the war in Europe have a favorable outcome for Ukraine. Now, I mean, I also have an interest. I mean, all Americans, let's just say it, all Americans should have an interest in what is going on there. We remember lessons, and I know that we don't, but you should remember lessons from World War II, whereby, Hitler gains territory before you know it. He wants to own the whole world.
Yeah.
And that is what's going on with Vladimir Putin. I mean, the same, the nonsense that he's talking about in terms of, he won't attack Kyiv and, he won't attack Poland. This is the same rhetoric that Hitler talked about. Just give me the Rhineland. He won't attack, Poland. He won't attack London. And that's exactly what he did. It was a way of simply softening people up to assuage their fears, to make them basically defeatable once he actually attacked them. So what we're seeing now is just a repeat of, we need to have, even if IMSIL didn't exist, there should be a vested interest in our government fighting Russia and really fighting Vladimir Putin, really fighting him back, because you're otherwise going to face him some way, somehow, if you basically give over a certain form of appeasement in terms of not stopping his aggression in Ukraine. It's just one of the fundamental lessons of going back to the Second World War that I know people don't think about, they don't talk about. It's not something readily on their head, but that is, Eric, that is what is happening in Europe right now. There is an aggressor that is trying to do a land grab, and they're doing it right now as we speak. That is what's happening.
Absolutely. And it's even bigger than that. I mean, going back to history, it is fascinating because I always been a history buff, but even more so when it comes to Europe after this happened, because I felt like my duty to kind of pay attention. But it is a virtual carbon copy playbook. I mean, I remember, we weren't alive, but like, it's almost like back in the day, there was a time in America before Pearl Harbor happened where we were like, we should just kind of negotiate with this Hitler guy. I mean, come on, it's just like, it's the same thing. It's like if we said, okay, you can have Crimea and you can have the Donbass or whatever, Hitler would just open the champagne and go, what idiots. Okay, here we go. Now, whatever,
Right.
Like,
what else can I take or whatever?
Yeah. But sorry to interrupt you, but I got to say this, because I don't get a chance to say this publicly enough.
Sure.
I usually mumble it to myself, frankly. So,
Sure.
But it's got all of it. Like, you have this once kind of pseudo democracy that had all this bad history that as Germany did. Putin swoops in as this, like, I'm gonna make Russia great again, and then starts slowly erasing anybody's freedom of speech and all of it. It's all the same stuff. And then oh my God, I'll get on such a tangent, but I really think this guy is Hitler reincarnated. I mean, just the only difference is we live in a nuclear age. And so, I mean, it's got it all. Like when it comes to Ukraine, you got the rape, the torture, the kidnapping, and the genocide. I mean, he's basically said...
And the graves in Ukraine. Don't forget about that. The graves.
Oh, yeah. Of course.
The mass graves. Yeah. They, that's happening.
Oh, yeah, it's all happening. It's all... But what's fascinating is that some even people that are close to me, they're like, oh, don't overgeneralize. That's too much of a... I'm like, excuse me. That is laser focused on point. There's no overgeneralization. It's like, it's like... And then another thing I'll say, which is a touchy subject... What's happening in Israel and Gaza is a horror show, given, true. But what's fascinating is the people that tend to be screaming from the rooftops about that and are so angry about what's happening to the Palestinians are the same people that are like, oh yeah, but that genocide's okay. You can kill all 42 million Ukrainians, but don't you dare commit genocide. And, it's just, for me, I'm just like dumbfounded by the whole state of it all. It's like,
pick your genocide. One genocide is okay and
like,
one isn't.
Oh, and another favorite of mine is, love this one. Oh, it's NATO's fault. It's NATO and America's fault that Russia's doing this. And I'm like, my response is, well, yeah, you're right. For allowing Russia to become what it has. It's definitely US and NATO's fault. You guys pretend to be the police of the world? Well, do your job. I mean, it's just like,
yeah. I mean, it's, Eric, you're so spot on with all, and this is a whole conversation topic in and of itself in terms of, I mean, they do academic lectures and whatnot on the things that are happening, how history is history is repeating itself.
Yeah.
They have a phrase amongst Jews whereby basically it will come again, but in another form, talking about the Holocaust.
Yeah.
And so, we're literally living in basically the same kind of precursors and conditions that led to World War II, that led into pulling the whole world into it. And this whole, it's not so bad, you're overgeneralizing. That's the same type of talk that was given before Pearl Harbor, before, Hitler, attacked Poland, before. That's the same. In fact, little history point, Hitler used a false flag attack to attack Poland. He made up an attack to go and attack Poland. And from everything I've read, the Ukrainians, I guess, did something. And so, therefore, Russia needs to respond or something like this. So it's like, it's the same stuff that's happening. And it's only been 70. In fact, here in Detroit, there's a poster whereby it's only been 78. So this must have been made last year. It's only been 78 years since the ovens, and it's put up by a Jewish group. And so it's true. I mean, my grandfather fought in World War II, and I asked him the other month or whatever. It's like, Pops, do you know who you guys were fighting? He said, yes, Hitler. I mean, that generation is still alive who fought against this. So it's not like this was, 10,000 years ago or something like this. It was literally in the lifetime of people who are alive today, and we clearly haven't learned something if there are people who are giving dismissal to you, dismissal to me, as to what's going on there in terms of what is happening to Ukraine.
Yeah.
It's believable and unbelievable at the same time.
But what's frustrating for me is these are people that I always considered like humanitarians and intellectuals who still can't see it. It's fascinating. It's fascinating. And but no, speaking of false flags, I mean, when Russia invades Chechnya, Putin just said, okay, let's just blow up these apartment buildings and blame it on Chechnya. I mean, yes, of course. I mean, it's again, this is the same playbook, and
it's right. It's the same tactic, and people don't pick up. Well, it's just a repeat of what happened in Nazi Germany. I mean, it's like, come on, like this guy he's Hitler reborn. He's Stalin magnified. He's all of that rolled up into one. And yes, as you brought up, we're living in the nuclear age. we should be even more fearful, because it's like, what will this guy do?
Yeah. Well, I mean, I think also is that people think that when people say like, Poland's next or Germany's next, and they're like, Hitler would. Excuse me, I almost look at that. I said Hitler, not Putin. Like,
they're about to say.
I know. Putin is not that stupid. He would never do that. I'm thinking, what planet are you living on? Have you not seen this? What this guy will do? He will cross any line. And also this whole recent rhetoric about when Macron said, we're thinking about, we can't rule out putting troops on the ground in Ukraine. And Putin stands up and goes, I will send nuclear weapons all over the world and destroy human civilization. And and the thing is that I kind of giggle. Like, I would actually worry if he said I would never use nuclear weapons. That's when I'm going to start getting really worried. Because there's like a motto that I have, and I think a lot of people have when it comes to whatever comes out of the Kremlin's mouth, and that is, okay, you have to analyze what they say, and as soon as they deny it, that's what's really happening. You know what I mean? So otherwise,
just take the opposite of whatever. But no, he's telling you straight up that they obviously have had whatever talks, whatever, in the Kremlin about the usage of nuclear weapons. And so, I mean, we're living, I think Jamie Dimon, CEO of JP Morgan, I think he's right in this regard. He's wrong about other things, but I think he's right in this regard in terms of we're living at perhaps one of the most dangerous times ever in human history, whereby an unhinged person like a Putin, whatever, has access to nuclear weapons, and they are desperate to exist. They're desperate to not die, basically.
Right.
And they will do whatever it takes if they feel threatened in pursuit of that. So I mean, just circling back around. I mean, as President Obama said, elections have consequences, and so I'm just taking that to heart. I mean, the most I can do as an individual, at least at this particular point in time, right now, in terms of affecting national, international politics, is to get out and vote for the people who share at least my same views in terms of we've got to support Ukraine. I mean, that we are Ukrainians. I mean, here in Metro Detroit, they still have it. I mean, there are Ukrainian flags flying on various homes. I've seen, it on people's vehicles, whatnot. And I just hope that energy converts into votes on Election Day in terms of really sticking it to Republicans to get out of the way in terms of helping the Ukrainians fight. I mean, Russia just took, what is it, Avdiivka, I think is the city. Yeah. That's a bad sign. So it's like they need help. They are somewhere on their, I mean, they're running out of what it is that they need. And it's we need to step in and help these people. Otherwise, it's kind of like a health problem. I mean, it's going to just get worse if you don't handle it now.
Exactly. And this is so hard for people to wrap their head around. And I think a lot of people in DC see it, and you see them say it, but the people that are blocking this funding, for example, they just don't see it. Like, if Ukraine falls, all of Europe is going to be in an all-out war with Russia. So, period. It's just going to happen, and as well as the United States, because he's going to keep moving. And so, do you want to try to nip this in the bud now, as tragic and as scary as that sounds, or do you want to give this entity another 5 to 10 years of war footing to get ready for the big next move? I mean, it's not going to happen overnight, but it's one thing about Russia too, I've noticed if you study their history, is they have stamina. They will go and go.
They'll play the long game.
Oh, they are such long game. And dude, I mean, I really even
they'll play the long game.
If you think about like the whole agreement where they had Ukraine give up their nukes in exchange for like being protected and yada yada, I think that was a part of the long game as well. As long ago as that was,
and this was a chess move.
Yeah, major. Yeah, and
I mean, Eric. I mean, that's obvious. I mean, Ukraine is it's a part of the former Soviet. I mean, there is a continued national interest in Russia of the old Russian Empire. I mean, look, obviously it goes back to World War II, whereby Mussolini and Hitler are trying to rebuild the old Italian and German empires. I mean, for those who just don't want to make the connection, they do more harm to us than maybe Putin is doing, because it's like they are a part of the people who have the resources to fight it, but they just don't take it seriously enough.
Yeah. Or I think a whole generation is extremely soft. Like, that's another thing, is that like people like Hitler and Putin, they prey on the weakness. They prey on
Fear.
Yeah. And the only thing they understand is, I know it's a cliche, but like the bully in the schoolyard, the only thing they understand is massive force pushback in a massive way.
It is. Yeah. It is. That's the only form of communication that they can understand, is that you've got to hit back. I mean, it's funny you bring that kind of analogy up. I always use that analogy whereby, the bully beating up on the little kid, that's bad on the part of the bully, but at some point you got to ask the question, when is the wimpy kid, when are we going to say it's a problem that he doesn't hit back? When are we gonna look at that and say, well, when are you gonna fight back? Because that's clearly the only way that this guy is gonna get it. And that's what we're in. I mean, we've got the resources, we've got the tools. There is no deficit in resources, just a deficit in will. Yeah. There's a deficit in the will of doing this, in terms of getting this done. And when I was there in Ukraine, there was, I saw whatever the missiles, the bombings, whatever outside my hotel that were intercepting the attack. I just cannot believe that the people actually live like that. I mean, I live here in the Detroit area. There's violence and crime and whatnot, but that type of violence going on there is different. That's indiscriminate. You have no idea where it's coming from and when it's coming. Yeah. And they're missiles. I mean, it could hit and blow up any and every. I mean, as humanitarians, on that front, we should be helping, we should be supporting, in any and every way possible. And I had that conversation with a friend. It's like, I am getting out and voting because we have to do it. We have to force Washington to put in the work and put in the effort. I love, you brought it up, I love the statement from Macron that they cannot rule out putting boots on the ground. It's like, hey, we need to come together and do this. Yeah, because otherwise, we don't. Again, I don't sound like a broken record, and not like I can pretend to predict the future, but again, just look at history. If you don't do this now, you're going to be dealing with it later, period. I mean, there's just like, if you got to shut this thing down. But Eric, why do people know that principle, but why don't they just do it? Why don't they just follow through on that? I know that that's a huge life philosophical question, but it's like, for just people, it's like, as long as it doesn't necessarily affect them in their face and their immediate life, right? It's just kind of until it acts. I mean, the discussion that we're having could easily be placed on climate change as well. How people just kind of keep going along, not doing what's necessary, and before you know it, the planet is in trouble. And, it's overheating, and, our weather, the climate has now changed, and it's affecting people and whatnot. I mean, there were warnings about this going back to the 50s or whatever, and people just didn't do anything then. I mean, I know what that is because I'm guilty of it. We're all guilty of it in a certain way, but it's like, man, it's unfortunate because it doesn't have to get to that point whereby it's like, okay, the problem really is in your face, and now you really have to deal with it. It's morphed into an issue whereby it's like, it's worse than what it should have been and had to be.
Right. And also, it's so funny is that that's everybody focuses on their own home turf. Like when it comes to something like climate change, everybody's focusing on the United States. What can the United States do, without paying any attention to like the carnage the rest of the world is doing? And like, let's go back to Russia for a minute. I remember in the early days of the invasion, there was somebody close to me, and I was just ranting about it, and this person said, well, there's people starving in Africa. There's so many more problems in the world. I said, excuse me, let's start with Africa. Do you understand that there's the Wagner group is in Africa raping and pillaging and like keeping everything in chaos? And are also, now that the Russian invaded Ukraine, they're keeping the wheat from getting there and just making more people starve? Like, how can you not see this? Then you talk about climate change. Russia has these huge ships like breaking up icebergs like daily and like completely destroying the icebergs. Setting up this big like floating military. Yeah. I mean, no one's talking about that. Like, it's like, the ice caps are going to melt. Well, Russia's certainly putting a fast forward button on that as well. It's just fascinating. It's just like,
yeah. Well, I mean, you're right. I mean, you're right. It's just frustrating because the problems don't have to be that way, but. Honestly, Eric, maybe they do have to get to that point for people to start giving a damn.
I think it does, unfortunate. Joshua, I think that's just simply how it's going to end up being. Yeah. It's just going to get that way again, unfortunately. Yeah. I joke and say if the shit hits the fan, I'm eyeing the French Polynesia area, New Zealand, and Australia, because I don't think those places are going to get hit.
Oh, okay.
Yeah, that's my personal.
Or I don't know, Greenland, Iceland. Those just kind of off the wall, off the map areas. Those would be. Yeah. Those would be the place to be for sure.
Sure.
Yeah. No, I hear you. But yeah, I mean, I think we're spot on in terms of it. Something devastating, unfortunately, has to happen for the problem to be addressed.
Yeah.
It's just unfortunate.
Yeah, it is unfortunate. You know what, dude? We've been going on for nearly 2 hours.
Oh gosh, have we? Yeah. I could probably go on for another 2 hours.
I know. So could I. This has been really a pleasurable conversation, Joshua. But I would love to. We can talk for a little while longer. I will go back and probably shorten this up a little bit. Yeah, I also am trying to be sympathetic to anyone listening to this as well.
Sure. No, I understand. I understand. You got to make things concise. I mean, the bullet points that I just want to get over is that, you really do have to be your own patient advocate. If you're dealing with something, there is help out there. You don't have to just kind of live with it and toil with it. I hate that I know that the only reason why I was able to do the things that I did is because I happen to have a job that has a good income. Mm-hmm. There isn't what we would call an income effect. Yeah. I just like to take the opportunity, hey, the best medicine is preventative medicine. Live as healthy of a life as you can. Because reaching this point in stage, I mean, they don't give a damn. They just don't. Live as healthy as you can. Follow those preventative measures. My particular problem is not dietary related. It is truly, hey, something happened to your bone structure whereby you have to get it fixed. But I'm saying that's very rare. But there's a lot of issues that can be prevented by living a healthier lifestyle. And I get it. That's hard, Eric. I remember listening to a CNN report, which a woman, I think she was living somewhere, Harlem, New York, whereby she said it was easier to get a gun than an apple in her neighborhood. So, and she wasn't laughing when she said it, but, it's like, I know that that's true. But, you gotta advocate and you've got to hustle and muscle to do the right thing. I'm sounding like Spike Lee now. You got to do the right thing, for yourself. I mean, look, Eric, I left some details out of the story. My wife wound up leaving me in the midst of all this. Because this stuff will make you feel crazy. It'll make you look crazy. And I guess, to some extent, I just, appear appealing anymore as a husband or whatever. I mean, there's a whole story behind all that, but I mean, my life kind of just, I'm at the point of just total reinvention of myself because of just the lack of care that I received.
Right. Well, I'm sorry to hear that.
I just, yeah. I mean, it's just,
that is an important part of the story. Sorry.
Yeah. That's a very important part of the story. But as you notice, I didn't even include it because that's so low on the list of just issues that I'm dealing with. But yeah, that's an issue as well. But throw that on top. But it's, without you, there's a message in my doctor's office, health is wealth. And it's true. I mean, I have been milked something like 80 grand from my account.
Yeah.
Fighting something that could have just been told to me from the get-go. Yeah.
But look at the bright side. If there is one, but you discovered this incredible technology. It's in the middle of a war zone. So exactly. I live by this. I have had no significant health issues, and I only got this therapy the first time just out of requirement if I was going to get them to trust me and all of that. But I've had it every year since 2016. So I've had it 8 times. I think I skipped it during COVID, I believe. But it's also interesting. Anyway, yeah. I mean, there's that's a pretty amazing thing that you've discovered, in my opinion. At least that's how I feel. And it's changed my father's life because he had type 2 diabetes, still does, of course. But he almost lost his feet, and the cells completely reversed that. And I was with him last December, and he's 80 now. I took him there for his 80th birthday. And I think we're going to go back in August for my wife's therapy. She's a little younger than me. She doesn't get it every single year like I do, but I'm just religious about it. I'm just like, okay, it's been 12 months, time to go back, no matter what's going on. But yeah.
Well, how are you doing in terms of health, Eric? I mean, you're kind of a case study in and of yourself, like repeat applications. I mean, when you get a cold, is it gone in a day? I mean, what happens?
Well, that's what's interesting. Okay, so so I'm 50. I'll be 52 this August, and so
Congrats.
Thank you. Yeah. My first therapy was 2016, and by the way, I just realized this year that I first started this journey. Okay, it's March 2014 is when I first cracked the book, if you would, on fetal stem cells, and it was 2 years after that it finally got to M-cell. Anyway. But I honestly, at the time, especially in 2016, I was burning the candle at both ends, multiple projects, overly ambitious personality I have been my whole life. And I just did not have any anticipation or expectations. It was more, I knew it was safe, but it was just a way for me to get in the door. By just, okay, I'm going to come in like everybody else, but just let me film it. I talked about this so many times. I'm sure you've heard this story, right? But okay, anyway, the point is, I was really just kind of shocked at how it affected me, my health. And so the first thing I noticed, which I've said before, is how it affected my brain. And how I'm a very high strung, as you can tell, I talk fast and, but, but I just found myself maybe not talking slower, but slowing down and kind of handling stress with much more grace than previously. And that was the first thing I noticed. And of course, little things, like libido increased and all these other things. But going back to what you said, but one of the things you asked about getting a cold, I've essentially never gotten sick since 2016, with the exception of COVID. I did, on the last, not that long ago, I did get a minor infection, bacterial, but I just knocked it out with antibiotics. But speaking of that, it was after my second therapy, I got strep throat and didn't know I had it. And so, because it's bacterial, so you can pick it up however you get it, And so I was walking around for nearly 3 weeks with this sort of weird thing in my throat, and I was still functioning normally. I didn't have a fever. I had plenty of energy, doing my usual daily life, without any thought, except that why is this weird thing in my throat still here 3 weeks later? I have an urgent care down the road from me, and where I live, I just walked into the urgent care and explained what I just said to you, and they swabbed my throat. The doctor came back, shortly after and looked at me really odd and said, "How long did you say you've had this?" And I said, "Oh, I don't know, 3 weeks." He's like, "Dude, you have strep. How are you even sitting here?" And I honestly, it was really a shocking moment. Like I just couldn't attribute it to anything else other than the cells protecting me during
Yeah.
dealing with it. And of course, they couldn't kill the bacteria. I mean, maybe they could, who knows? But antibiotic just completely knocked it out. I also do know that I understand the science so deeply, and I understand what they're doing for me. I just know in my heart and soul that I did a good thing for myself. You know what I mean? And also getting older, cardiovascular issues, and all those things that come along with getting older that you have to keep an eye out for. I just know. I mean, I was given cardiovascular heart cells. I was given endothelial cells to keep my blood vessels working great. And so, yeah. I mean, I feel great. And of course, what's interesting is if you remember my telomeres, I was sort of an interesting sort of guinea pig I was one of the many people that in this clinical trial just sort of proved that the cells remain in you. And so I feel very grateful to be a part of that study. I wish I could still do it. It's very expensive to get these telomeres tested. And so like the trial ended and that was it. But I don't know, man.
It was in Ukraine, correct?
Yeah.
Okay, yeah, because I had asked them about it when I was there, and they let me know that that's not basically a part of the therapy. I was like, I would love to get it measured.
Yeah, I know. And so it's funny because when they realized I was going to put that in the movie, they're like, "Oh, wait, you can't do that because everybody's going to want it." I said, "Excuse me, this is huge. Like, I have got to put this in the movie. I'm doing it." It's like, and of course, sure enough, everybody wanted their darn telomeres measured, and they had to be, they had to just keep turning them down. And I can't even get them measured anymore. But I did have it for a very significant amount of time. But I often joke, and this is kind of a bad joke, but I'm just kind of a walking Frankenstein. I mean, think about it, 8 times. With all this foreign DNA, like completely meshing with me. And again, going back to the telomeres, when I went from, I don't have it in front of me, like 0.25% of my population was long telomeres to 8.5% of my cell population with long telomeres, does that mean that over 8% of my cells are foreign DNA? Maybe. I don't know. There's no way to prove that, but.
Yeah, who knows?
Yeah.
Who knows? I mean, me going back to work, definitely, and me being better, it obviously is attributable to whatever degree to the cells. Because, I mean, look, I spent 2023, the majority of 2023, almost literally in the bed, Eric. I just could not get up and get out. When you're dealing with intracranial hypertension, for the whatever small community out there who deals with it, I'll just say it out loud. You have some very dark thoughts about how to get rid of it.
Sure.
Just put it that way.
Yeah.
I mean, it is literally like that. You're laying in bed and whatnot. It's like, this cannot be existence. And I, by and large, don't necessarily deal with that aspect any longer. I am better post-IMCEL in a way that I wasn't.
Yep.
And I saw enough objective evidence whereby it's like, yes, this therapy works. If anybody is listening to this and the main thing you get out of this, IMCEL, fetal stem cells work. It works. It just does. So, and I, as a practicing scientist, wouldn't say that if I did not have the measurables which back that up. My personal measurement of things, coming back to America and getting measured, it's like, okay, that only happened because I went to Ukraine. So that's kind of my message. In fact, my mom, she deals with RLS, restless leg syndrome, which is basically a dopamine neuron kind of problem in the brain. I let her know, and her and I were just talking about this the other day. It's like, I want to take you to IMCEL.
Yeah.
I mean, I wouldn't be suggesting something for my mother that I knew didn't pass the sniff test personally for me.
Sure.
And so I know that it's going to help her because I've seen it help me. I've seen it do great things for others. But look, the primary thing that people need to understand is that technology can cease to exist if this whole aggression is not dealt with the way that it needs to be dealt with. We have an interest to address that. I there's just so many moving variables. It's like, gosh, I wish I had discovered incel long before this. I mean, I wouldn't have to be thinking about, the war crushing, because those people are kind of my doctor now. I wouldn't have to think about, the war crushing my hospital, but, hey, I wouldn't have become as politically active as I am without this. I'm politically active because of this. So, you never know how life kind of works, Eric, how things affect other things. I mean, it's good to get more politically active because it's helping others in a way that perhaps, let's just be honest, maybe I wouldn't have cared as much. Maybe I wouldn't have.
Yeah.
Maybe I just wouldn't have.
Right. Yeah. Yeah, that's true. Yeah. Yeah, I mean, for me, when that Russia invasion hit, it was absolutely devastating. Like, oh my God, you've got to be kidding me. Like, it's after all this, like, aside from all the people that I know and all the dozens of times I've been there, but like all this work I've been putting into this, and like all this work I'm putting in to cover this, and you're telling me that they're just going to take it away? Like, aside from the violence of it all, but check this out, just as a side note. So I had the movie like fairly done, I thought, and then COVID hits. So I'm like, all right, well, I can't really. And I actually was working on another project at the same time, this crazy story called The Andorra Hustle. Did you ever watch this by some chance? You should check it out. You might enjoy it. Actually, because you have your mind will really follow this because you're intelligent enough, I think, to follow it. It's so complicated, kind of like the fetal stem cell story, but this crazy scandal that occurred in Andorra. It involves the U.S. Treasury, these pro-Franco, anti-Catalonians, and anyway.
I've heard of. I'm somewhat familiar with this. I don't know the full story.
Well, if you just go to ericmerola.com, it's free on YouTube. I mean, it was my most well-received movie. I got like almost a perfect Rotten Tomatoes score, but it was the least seen movie I've ever done. I got The Guardian wrote a glowing review about it, which has never happened for any of my movies, just because of my subject matter. Anyway, the point is, COVID hits, puts everything on pause. I think I have the movie done again because I had all this new stuff. Then Russia invades. It's like, what? I mean, this movie went on, and I kind of started it as soon as I got done with the God Cells. And of course, I can't possibly release this movie. First, I had to see what was going to happen. So by September, it started in February. By September that same year, I was like, well, I can't possibly release this without going there and during the war. I mean, oh my God, this is a part of the story now, right? And it's just part of being a journalist. You don't know what's going to come the next day. Anyway, and finally I did, of course. But yeah, it's intense. But going back to what you said, yeah, I'm the same way. I have a lot of vested interest in seeing Ukraine survive.
Much vested interest. I mean, I'm telling people that I know, my neighbors, about, register, we just do it. And I just, I would not be this way if not for this. Yeah. So it's a good and the bad, Eric. It is. I happen to be a person of faith. There's a good even in the bad. Yeah. So I believe in that. And so yeah, I mean, I really do.
Absolutely. I completely feel the same way. Absolutely. I mean, look at something as simple as the tragedy of Chernobyl, something so horrible, and then look at the good that came from that. Not that we would ever want that to happen again, but it did happen. And these brilliant scientists were able to parlay that into something beautiful. So, yeah.
Right. Excellent point. Excellent point.
All right, man. I can honestly speak to you all day, but I think we should wrap it up. Well,
Eric, let me end by saying that I appreciate the work that you do. I wish there was more like you. I would not have had the trust and confidence to even go get on a plane and go to Ukraine if it wasn't for your film. I wouldn't have done it, period. I don't care what I had read. It was because of your film that I did this. So please continue to, as a journalist, you have, I believe, a responsibility to inform people, apprise people of what the truth is. And you're doing that. And I'm just happy I came to the intersection of your life and your work because it's affected my life. Just ask.
Thanks, man.
Thank you. Thank you.
Well, you're welcome. You're welcome, and thank you as well. I mean, it obviously what keeps me going, and in a weird way, like it's one of the most exciting things I've ever discovered, frankly. And it's so crazy that I'm basically the only person on earth, like in a large, loud way, trying to alert people that this thing is happening. That this thing exists.
Yeah.
Well, yeah. So, and I kind of feel like what?
Keep it up, Eric.
Thanks.
Please keep it up.
I will. I feel an obligation to stick with it, really, for that only reason. I kind of joke within myself to say, I really wish somebody else would start paying attention to this so I can, move on to something else.
No, buddy, this is your wheelhouse. Right. I mean, carry it proudly.
Cool. Well, let's stay in touch. And I don't know when you mentioned you have to get some other things done before you can go back, but I think there's a high probability we'll be there in August if you wanted to try to go at the same time. I don't know if that works with your schedule. It's only March now. So
do you think you'll be taking the train?
Actually, I haven't decided. Here's funny. My wife loves the train. I prefer the van. My wife gets a little car sick with long journeys, so we haven't decided. Why do you ask?
That train scene, I mean, I know Sophia complained about it. I don't know if Zinzella complained about it. 17 hours seems laborious. I'm trying to think about what's the best thing for my mom.
Okay, here's an important thing to consider. The train on the way to Kyiv is an old Soviet era train, no air conditioning.
I saw that.
It's August.
No air conditioning.
Yeah, so that should just settle it for you right there. Yeah. But there is something kind of cool because we went, in September. It was a little on the chillier side, but there is something kind of cool about you have your own little private car. We just downloaded a bunch of movies, got our food, and it did get like, oh my God, really? How much longer is this going to be? There was an element of that, and the van, it's just two totally different experiences. And the van is easily 5 hours shorter. You did it, but yeah, the train is long.
Okay.
Yeah.
Okay. I mean, for me, the van was fine. I'm a tall guy. My legs were not cramped. So, yeah, let's keep in touch on that because maybe August time period I'll be able to go. And let's just keep in touch on those moves.
Absolutely. And I don't know if you already know this, but at the end of July, Sophia and Zinzella are probably going.
Yeah.
Okay.
Zinzella told me, I think the other night that they're trying to go in June, July, one of the J months. So they're trying to go. I probably won't be going at that time period, but August sounds more likely, but definitely I'm going back. I mean,
Well,
definitely going back.
I mean, I talk to people, like on average, maybe 12 people a month ish that contact me and usually end up going. So I don't know if you wanted to just be private with you and your mom, or if you wanted to share again to, it's up to you. But I could probably hook you up with somebody if August doesn't work out for you, if you wanted to do that.
Sounds good.
Yeah.
Sounds good. Hey, Eric, I appreciate the call.
Yep.
Take care. Continue doing what you're doing, and we will keep in touch.
Absolutely. Josh, this has been an absolute pleasure for me. So let's stay in touch.
Thank you.
All
Thank
right.
you. Take care.
You too. Bye.
All right, bye now.
That concludes episode 21 of the God Cells podcast. I am Eric Merola. My email, eric@ericmerola.com. That's ERIC@ERICMEROLA.com. Feel free to subscribe to my mailing list at ericmerola.com. And hey, if you are listening to this on YouTube or SoundCloud, giving it a like and or a subscribe certainly helps out the channel and helps me reach more people like you. And of course, you can find me on Facebook and Instagram. So until next time, episode 22, I am Eric Merola. Stay safe out there.